Hello everyone, welcome to today's webinar. We're going to talk to you about our one-of-a-kind, scientifically proven, clinically studied, medically supervised weight loss program and what separates it from traditional diet programs. Hello, my name is Larry Walters and I have over 20 years of experience in the areas of health and wellness. I'm a certified health coach, speaker, and health educator. Along with me and my partner, Dr. Anix Luberis, who is a board-certified holistic health practitioner, naturopathic doctor, and an award-winning weight loss expert. In today's webinar, we're going to share with you some of the things about our program and some of its benefits to you as a potential client. So let's get started. Dr. Luberis, why is your program one of a kind?
Our program is one of a kind because it uses the best of science. Also, it uses the best of education, true education, because there's so many different things out there that true education is the most important thing. And it uses lifestyle intervention.
Okay, so now why health coaching? What's the purpose of health coaching and its benefits?
Health coaching is very, very important because oftentimes it's difficult for an individual to do it on their own because there's so many contradictory information out there that it's very difficult to decipher through all of this information. So by having a health coach, someone that is experienced in that area, someone that has helped many different people in that area, it makes the journey a whole lot easier. It makes the pitfalls and the learning experience and the learning curve so much more easier than going about it on your own.
So to add to that, whether your goal is just to lose weight or to, let's say, increase your energy or just get healthier, here at Diet Coaches, we take the time to listen to your concern. We want to help you to discover where and the why you're struggling and to help you navigate the world of contradictory nutritional advice and to figure out exactly what works for you. Now, everyone is unique and different. That's why no one diet works for everyone or only works for a small amount of the time. Our professionals, they don't promote one specific type of diet or one specific way of eating. They help you experiment with finding what works for you specifically and how to change up your diet and lifestyle as you continue to grow and make those strides forward. Now, okay, Dr. Luberis, why medical weight loss versus, let's say, traditional weight loss programs?
Well, traditional weight loss, we're going to start with that first. There's so many different things out there to try. There are so many different programs, so many different things being pushed at you. There's too much to pick from. This type of program, there's this pill, there's this potion, there's this exercise plan. There are so many out there, and most of these programs are designed by people that sometimes don't really know anything about weight loss. They just probably just read a book or took a couple of courses and they put themselves out there as expert or whatever that may be. But medically supervised weight loss means that you're supervised by a doctor or professionals in the area of weight loss. So it is like apples and oranges when you compare the two. Medical weight loss is by far the best way for a person to go if they're serious about their weight loss.
Now, just to add with what you just said there, doctor. So medical weight loss, it's not about surgeries or fancy pills. Now, the medical in the name seems like it could mean surgery, but it doesn't in this case. Medical weight loss means that a medical professional, as you mentioned, or a professional in the field of weight loss advises clients on their weight loss journey, so to speak. After all, losing weight often requires someone holding you accountable. That's the key, accountability, along with guiding you along the way. Now, the main difference is that a diet is a restriction of food or eating certain food or to lose weight. With traditional diets, it's all about what you consume or counting calories or counting points, so to speak. So, Dr. Luberis, so now what is your view on lifestyle approach and weight loss?
Totally the best way to go about weight loss and losing weight. And the reason I say that is because 4 of the top 5 diseases that we get is lifestyle diseases: heart disease, diabetes, hypertension, cardiovascular disease. These are diseases that we primarily give to ourselves based upon our lifestyle. You see, most of the time when we go to a doctor, the doctor or the nurse, most of the time it's the nurse, will give you out a form to fill. It's called your medical history. And on there, you usually have a question that asks you about your family history. And the reason we ask for your family history is because because if mom did something and dad did something, most of the time you're going to do the same thing as well. So what that means is that if your mom lived a certain way, you're going to live a certain way. See, I think most of the time we're confused when a doctor says to a patient, well, it's genetics, it's hereditary. Guys, I want you to think about this. Just because your mom lived a certain way and had a particular disease such as obesity or even diabetes, it doesn't necessarily mean that you're going to have that disease as well. Put it this way, genetics loads the gun. Lifestyle is what's going to pull the trigger. All right. The way you live is what's going to determine if you're going to have that disease or not. It's not based upon your genetics or your family or anything like that. Genetics does play a role. You're predisposed to that disease, but it doesn't necessarily mean that you will get it. So lifestyle is extremely important. It's one of the pillars to weight loss.
Okay, I especially like that part about the genetics loads the gun, but lifestyle pulls the trigger. All right, did you hear that, people? Now, just to add to what you said there, Doc, you said our program here with Diet Coaches is, as we mentioned, it's medically supervised weight loss. So we use a lifestyle approach, not just pills and potions, but lifestyle management. So our doctors will guide you through nutrition, exercise, and even behavioral counseling. Now, the doctors or coaches are not just there to tell you what to eat or to act as a nutritionist. However, they're not your personal trainer either. Now, our medical staff, they show you how to lose weight, as we mentioned earlier, with diet, with exercise, and managing those behaviors so you aren't tempted to slip up. Now, Doc, what is your take on, let's say, personalized approach versus a cookie cutter solution or one size fits all?
Well, most of the programs that you run into out there are one size fits all. You would go online and you would sign up to these programs, and the program is pretty much structured, and you follow these courses, you eat these meals, you drink this potion, you drink this shake, and you do this exercise, and you lose weight. Yeah, that's all good and all, but everybody is not the same. Everybody doesn't function the same way. So the program cannot and will not work for everybody. Reason being is because it's not personalized. It's not tailored to you. So most of these cookie cutter solutions out there are one size fits all. But our program is a little bit different. It's customized and tailored to you, to your liking, how you're living. You see, we don't try to fit you in the program. No, we fit the program in you. What that means is that your program is customized and tailored to that individual, to that individual's lifestyle, to that individual's way of living. Reason being is because that is the best way to be most effective at what we're doing, is to make it tailored to you and not just having a one size fits all program where it's just like shooting in the dark and hoping that you hit something.
Yeah, and I heard it said once, Doc, that a health professional said that what's the best kind of exercise for an individual to do? And guess what his answer was? The
exercise he does.
The one he's going to stick with.
Exactly. Exactly.
All
Exactly.
Right. So no two people are alike.
Yep.
Okay. So then, Dr. Luis, why do you think there is so much contradiction in the wellness industry?
I think it's because there's so many things out there. It's a cry for help. Everybody think they know what to do. Everybody is trying different things. But one of the things that we're failing to understand as people in whole is that it's not just weight loss. All parts of life have laws. There are laws to health, just like there's laws to weight loss. If you follow these laws, you will reap the benefit, no matter how. It does not discriminate. So there's so much contradictory because so many people are trying to do so many different things. Listen, guys, you can drink water for a whole week and you'll lose weight. You can just go on a juice fast and you'll lose weight. You can do a lot of things to lose weight, but the problem is not losing weight. The problem is sustainability. The problem is keeping that weight off. Keeping it off for a long term. You see, one of the things that we lack, and one of the things that most of these cookie cutter solution programs out there lack, is personalized education. And that's one of the things that we do deliver, and one of the things that we do give.
Okay, good answer. Now, I just wanted to add to that. Now, health, as Dr. mentioned, can be impacted by many different areas of your lifestyle, from your diet and even relationships to stress, or even sleep. This means that your approach to health needs to address all areas of your lifestyle at once. in order to be effective and long lasting, as you've mentioned, because there are these 8 laws that are going to help make you a whole person. We don't just affect one area, not just eating and drinking, but everything of your life. So unfortunately though, in today's medical world, doctors, insurance companies, and even hospitals provide minimal to no education and assistance in lifestyle transformation, and most health coaches and personal trainers are just too expensive. Now, I've heard it said that what we need more of is more education, not more medication. Some famous person said that. Now, the principles used in our one-of-a-kind program are not only empower you to regain control of your health, but to simplify losing weight, reducing your cholesterol, or as reversing your type 2 diabetes so that you can feel like yourself again. Okay, so now Dr. Lou Reese, let's shift gears here. We've given the people a lot of information about what we do, how we do it. So Dr. Lou Reese, I'm sure the million-dollar question that everyone out there wants to know is what plans are offered and what are some of their benefits?
That's a very good question. We have 2 plans that we offer to the general public. The first plan is the professional plan. Now, the professional plan consists of a lot of things that are similar with our other plan, which is the doctor's plan, okay? So there are very similar plans, but the doctor's plan has a little bit extra that the professional plan does not have. This is what the professional plan comes with. It comes with a 1-hour consultation call, a game planning session with a doctor outlining everything that needs to happen during the program. You will get your own professional coach. Okay, you have a coach that will walk you along your weight loss journey. On top of that, you will get concierge nutraceutical services. What that means is that your health coach, along with the doctor in the professional plan, will be working side by side with you, helping you to get the proper supplements that is necessary to get you to your weight loss goal. You will be learning the laws of health, which we talked about previously, that is so important when it comes to weight loss. On top of that, we will be taking you through a step-by-step process, meaning we're not going to try to throw everything on you at once. We're going to take you through the program step by step, one step at a time, which is called our 1, 2, 3 all together now plan. The next thing is omnipresent technology. What omnipresent technology is, we use the best of technology to help to track your activities and also to help to keep us in the know of what you're doing on a day-to-day basis. So we'll be able to track what you're eating, how much exercise you're getting, how much sleep you're getting, what time you're going to bed, what time you're waking up. Guys, we're tracking pretty much everything that is necessary to get you to that goal. The next part of our program is balancing physical activity with your nutrition, okay? So what that session is, it helps us to be able to balance what you're eating with the amount of physical activity that you're getting. So it's not about counting calories, it's actually about eating calories. Eating the right amount of calories and eating the right calories to get you to your weight loss goal, or should I say your health goal. The next thing that we offer on our program is exercise plan. Exercise that works, not hurt. Let me say that one more time. Exercise that works and not hurt. Most of the time we see that when we do exercise, it really hurts. And some people, after the pain, they don't return back to that exercise. So we're educating you on exercise to do that will work, not hurt, that will help you towards your weight loss goal, not hinder you because of the pain and all of that other stuff that comes along with exercise. But behavior modification, educating you on how to change these habits, these eating habits, these bad habits that is making it difficult for you to reach your weight loss goal. These are some of the things that are offered on the professional plan. On the next page, guys, you will see a whole list of some of the other things that I haven't covered. So this is just part of what is offered in the professional plan. Now, the difference between the professional plan and the doctor's plan, besides price, is that the professional plan does not allow you access to a medical professional. What that means, guys, is on the doctor's plan, you get everything that I just talked about on the professional plan. But what separates the professional plan between the doctor plan is that the doctor plan, we promise you a 15% no-fail promise. So that means that when you're on our doctor's plan, we promise, or we can say we guarantee, that you will be on track of losing at least 15% of your body fat when starting that plan. And if you do not get there, we will give you an extra 3 months for free, because we really, really want to see you get to your goal. So we're promising that we're going to get you there one way or the other. Now, another thing that's offered on our doctor's plan that is not offered on the professional plan is you will get your own personalized doctor's phone number where you can call during normal business hours, or you can text. You have a doctor right beside you that you can call at any time. That is not offered in the professional plan. And that's the professional plan and the doctor's plan.
So there you have it, folks. If you'd like more information on our incredibly low prices, as well as the services that Dr. Luberis did not mention, please fill in your information below and we'll see you on the other side. And always remember, your health is your choice.